Welcome to LECOM Health Matters. Our guest today is our good friend, and welcome back, Dr. Ryan Lynch. Dr. Lynch, welcome. Thank you very much for being with us today.
Thank you, Monsignor. I appreciate it. It's great to be here.
It's great to have you here. We're taping this right before the holidays, so in advance, I wish you a good holiday, a blessed Merry Christmas for you and your family.
You too.
Well, one of the byproducts of holidays is headaches, and you're the headache expert. So I'd like to talk a little bit about headaches, frequency, and migraines in the 15 minutes that we have.
Okay.
But Brian, could you tell us a little bit? We all have them, but what actually is a headache?
In most senses, a headache is a dilating artery in the brain. It'll dilate and constrict. For the most part, if we could take off our skin and our scalp and the skull and release the brain, touching it, smacking it, cutting it, we wouldn't feel it. It doesn't have that type of nerve endings in it. But what does hurt is the arteries in the brain have a musculature to them. So when they dilate or spasm or become constricted or smaller, that spasm in that artery's muscle is what actually causes that terrible pain. And stress is probably the number one trigger, maintainer, and worsener of all headaches, whether they're just a normal headache, a tension type headache, or as bad as a migraine or a cluster headache.
Well, Ryan, when someone has that shrinking vessel, to use an inarticulate word, what relaxes it so that the blood flows and the pain goes away?
Any type of NSAIDs that would be a non-steroidal anti-inflammatory medication you take over the counter. For the most part, most patients will use over the counters. That would include your aspirin, ibuprofen, or Aleve, or the things like Excedrin, which is a combination of acetaminophen, aspirin, and caffeine. All of those will help. The only problem with those is that's not listed on the bottle. Even on prescription meds, it's not often listed in the side effects. Is too much of a good thing will cause a headache too. So a lot of the headaches that I see in my clinic are stress-induced and then also worsened by, we call it medication overuse headaches. They take too much of the over-the-counter medications. But under normal circumstances, if you have anything that's inflamed, you take something that's an anti-inflammatory, that should make it better.
Is that what's called a rebound headache?
Correct. It's rebound headache, drug-induced, or medication overuse headaches are all the same. But any over-the-counter pain medication, including Tylenol, will do it, as well as any narcotic medication that's prescribed by a physician.
Brian, Dr. Lynch, when should someone worry relative to the frequency of these headaches, or does it matter that the kind of a headache that it is? I mean, when should I think of picking up the phone and calling you if I'm having these headaches?
I think for most of us, everybody gets a headache to some level. And I think when you should get concerned is when the frequency or the severity of what you normally get is worse. Meaning maybe you go from having one every 2 weeks to having one every day for 2 weeks. That would be a reason to call your doctor. If you have one that normally is like a 3 out of 10 for severity, and now it's an 11 out of 10 for severity, that would be grounds to call a doctor as well, or go to the ER if you just can't take it anymore. Some headaches will produce deficits or symptoms of like a stroke. You might get numbness or tingling that's new to you, or weakness, or some patients will get like a tunnel vision. Obviously, those things would be either ER or your family doctor right off the bat.
You mentioned earlier in our conversation, Dr. Lynch, a cluster headache. What's a cluster headache?
So a cluster headache, most lay people and some physicians who don't deal with headaches believe it's a severe pain headache, and it is, but it clusters. And the main definition is most of the patients that have these will be able to mark on a calendar, almost predict when they're going to have it's basically a week of severe headaches. It's usually a 40-year-old male Caucasian that gets these types of headaches, and they're a smoker. If I had any residents in the audience or medical students, that would be a classic board question. But they come in clusters. So just having a severe headache every day of your life is not a cluster headache, and it's often misdiagnosed. That would be more or less probably a migraine. But I have many patients that will tell you, yes, doctor, the third week of March every year, I will have a whole week of the worst headaches of my life. And that's what a cluster headache syndrome is.
Well, you mentioned it, and now let's turn to really what we want to talk about today are migraines, because I see you driving up Peach Street every day. I see your lovely face there saying, if you have migraines, call me. Let's start with the basics. What's the difference between what we've just talked about, a headache, and a migraine?
All migraines are headaches, but not all headaches are migraines, obviously. What makes a migraine different than just a headache is you don't actually have to have a headache to have a migraine. One of the more common types of migraines is something, it's been named many different things, an ophthalmic migraine or a retinal migraine. And these are patients who will see squiggly lines, look like lightning strikes in their vision, but never actually get a headache or any head pain with it. Migraines are defined as they're considered a primary headache, meaning they're not caused by anything else, say medications or a tumor or a bleed in the head. Migraines are their own thing, so they're considered a primary type of headache, and it's named for all the baggage that comes with it. Most patients with migraines, in addition to a headache, will have nausea and vomiting with it, will have severe dizziness, can have blurred vision. They also There are patients who will have migraines with the squiggly lines in their vision, with the headache pain. That would still be a migraine as well. Another common symptom with migraines is smell, light, and noise sensitivity. So that typical patients with migraines, you may have a mother, or they occur more in women than men. So you might have your mom who has to go to a cool, quiet, and dark room to sleep off the migraine because they're so sensitive to the light and sound. Um, so that's the primary difference between migraines and other types of headaches or
Do they exhibit more in males or females?
females.
Females more than male. And that's
Whereas
basically,
cluster headaches are more in male than female.
oh, really? Clusters are in males. Females get the unpleasant joy of getting migraines. So
Women don't,
if I get them on a frequent basis, and I'm a migraine headache sufferer, as you know, but if someone listening to us, because I think that migraines can be, if you've never had one, they're truly debilitating to some. I mean, you can work through them, but you know what it's like. It's not
yes.
pleasant. But when it comes to the point that I should call you if I'm getting a couple a month, probably it's good for me to call you, isn't it?
Yes and no. So a couple was if it's 3 or more, you should probably call a neurologist or your family doctor. 2 or less, you can use. So usually medications that we use or treatment for migraines goes in 2 categories: a rescue medication versus a migraine preventative medication. So anything over the counter that you get over the counter to treat would be considered a rescue medication, and that's designed for patients who have 2 migraines or less a month. However, if those 2 migraines are terrible and an 11 out of 10 for severity, I would probably recommend seeing a family doctor or a neurologist to get a prescription rescue medication. That would be something like sumatriptan. The brand name would be Imitrex.
Matrix.
But if you have 3 or more headaches a month, it's my suggestion to go on a migraine preventative medication, which you would take daily, whether you have a headache or not.
And
Or it's a medication that lasts for a month.
before we go any further, because I think it's important to clear this up for the audience, I know the answer to the question, but do I have to go to my primary care doc before I call you, or can I just call you?
That would depend on your insurance, and if you don't know, you could call us and we can help you to decide. But I think it's always nice to have a referral from a doctor. With inflation and money, you get a referral, and your insurance is more likely to pay for that visit versus if you refer yourself. But I know many insurances these days don't require a family doctor's referral for you to see a specialist.
Because you are a specialist, and I think it's important that we make that clear to those who are watching and those who are listening. But going to their family doctor, getting a referral to you is probably their safest line in making sure that the insurance covers the cost.
Correct,
So,
and they might even give you a medication to start on the way to seeing me, so you get relief immediately on the way to seeing me.
so when I come to see you with my migraines, what happens? You put me in the hospital or what?
No, we have a nice talk, and I take what's called a history, so I get an idea of what type of headaches you have, because there are different versions of migraines as well. And then we talk on quantity and quality of the headaches as well. So, like I said, if you have 3 or more a month, we talk about preventative medications, and we also can prescribe rescues with those. Um, and I'll examine you, make sure, as a neurologist, we're always looking for, is one side different than the other? If you have, and we call that a focality, if you have a focal deficit, it's called, on one side versus the other, that could mean that something else is going on. There might be a problem in the brain or your spinal cord that needs to be worked up as well. In most insurances will not cover brain imaging as a CAT scan or an MRI in an office visit unless they are very frequent and very severe. But as a neurologist, I'm always going to try. I want to get a good picture of your brain if you're someone who's suffering from any type of headache that's quite often and quite severe.
You know, you said something, Dr. Lynch, that I did not know. You said there were different types of migraines?
Correct. There's your regular run-of-the-mill migraine would actually be called a migraine without auras. Auras are warnings to your headaches that aren't pain or pressure. Some patients will see those squiggly lines, and they usually have 15 minutes to maybe a couple hours before the headache pain ensues, along with the other symptoms like nausea and vomiting and lightheadedness. Those patients have it easy in some ways, and those are called migraines with auras, because they can take a rescue medication and abort the headache before it gets severe. But most migraines, the most common migraines, don't have that warning involved with them. There's also ones called tussive headaches, or tussive migraines, they used to be called, and that's from coughing fits. You increase the pressure of your head. There's exertional migraines, which are more common in men. We'll see that in a lot of weightlifters and athletes. There's also ones called complex migraines or hemiplegic migraines. These are migraines where once you get the headache, the patients will have deficits like a stroke. They are temporary, but that could be a facial droop. It could be numbness and tingling on one side, weakness on one side. I mean, there's many times where I'm sure I've given hemiplegic migraines in the ER, TPA, which is the drug we use to stop strokes or to treat acute strokes. But because sometimes you just don't know until you do the full workup on the patient. But hemiplegic migraines are quite scary, especially the first one you have.
You know, we've talked a little bit about, once I'm diagnosed with a migraine, about rescue medications and preventive medications. Can you talk a bit about the difference between the two?
Sure. So the rescue medications are designed to treat the active acute migraine, and most of them may last a few hours of relief it's supposed to abort it. So the main goal is to, as soon as you take it, if you take it early enough, the headache won't get worse and it will go away. However, even those medications, the ones I'm thinking of are called triptans. The most common one is sumatriptan, or Imitrex is the brand name. Too much of that can cause a medication overuse headache as well. But for varying people, that can last a couple hours. It could take it all away. There's a couple others. You can use a medication called Toradol or Ketorolac. It's a very, very strong non-steroidal that has to be prescribed or given as a shot. And that tends, in my opinion, to work better than the other ones. And the triptans, too, can cause heart attack and strokes in some patients because it's a potent vasoconstrictor. So we'll take that dilated artery in the brain that's spasming and constrict it and get rid of that spasm, and the headache goes away. So there's many different, and then there's, I want to talk about CGRP inhibitors. There are new, or GPANTs, GEPANTS. There are these new brand of, a new type of migraine medications that came out in 2018 and have revolutionized migraine care, in that there's two rescue medications that can be used. Brand name is Ubrelvy and Nurtec. These are rescue medications that will last days if you take them, and definitely abort the headache very quickly. And then there's now 3 shots that you can take once a month, and they last for 30 days as a preventative migraine medication. But prior to these drugs in 2018, sometimes you had a lot of patients that you could definitely minimize and improve headaches, but they would never go away. And these new medications have really revolutionized how much we can help you.
Oh, as one who gets them, yes, they are. They can be debilitating. And if it gets to the point that the rescue medication doesn't kick in, or it's too late, then what?
Then we have to talk about either going to the ER and having them give you a cocktail. Usually the cocktail includes the Toradol that I talked about. They'll give you an antiemetic or an anti-nausea medication, and usually actually Benadryl or steroids, and they give it as a cocktail that's usually through the IV, and then the patient can go home. In my office, I actually give Toradol to my patients if they want as an IM. It's through the muscle as a way to keep them out of the ER, because the wait could be hours to get into an ER,
That's
and it
true.
might be another few hours before you leave the ER. If that does, if but I always tell patients that are on rescue meds, you definitely insurances only allow for 9 of the triptan medications per month. And I always tell them, if you're blowing through all 9 of those in a month, you need to come see me so I can start you on preventative medication. I,
Yeah.
I, I prefer if patients only take those 2 to 4 times a month, even closer to 2. I feel like the preventative medication isn't working well enough if they're having to take the whole 9 a month.
Dr. Lynch, as we start to wrap this up, if someone is a migraine sufferer, or for that matter, a headache sufferer, are there lifestyle things that we can do? If, I get headaches, I know that. Are there lifestyle things myself and the audience can do to not eradicate them? That's not going to happen, but at least reduce the potential of them coming?
Yes. And I should back up too. There's no medications that'll take away everything. I mean, you have to accept some headaches. And usually, even the new ones, I tell them you're going to have 1 or 2 a month. But with that, absolutely, yes, Monsignor, you can, part of the workup or the history I will take is how much caffeine do you take in a day. And it should be 2 cups or less to prevent you from having a lot of headaches. More than 2 cups, you might as well accept the headaches. And I'm a
Oh
big
God, I'm a sinner there.
yeah, I know. I'm a big coffee addict,
That's
and
my strike one.
I accept the headache. Again, too much of a good thing is a bad thing. So that is where I start first. Skipping meals. A lot of days everybody wants to worry about their figures, and skipping meals is part of their diet. I recommend if you're going to diet, try to use 6 small protein meals a day. And because as soon as your blood sugar dips below, say 90 even, or 60, you're going to get a headache. That's just part of the symptoms of having low sugar. Um, so always try to encourage healthy small meals, but multiple times per day to keep your sugars at a nice basal rate. Um, Caffeine is a big one, and then artificial sweeteners are big. Almost every artificial sweetener will provoke or maintain a headache. The blue packets, I won't use a name for those, but the blue packets are usually considered to be the worst. The pink packets and the yellows aren't as bad, but all of them, if you do too much of them, will lead to a headache. For those who drink alcohol, anything that's a sweet alcohol or a lot of preservatives in it, like red wines, will definitely provoke headaches. A lot of homemade wines do not, despite being red. Like reds out of wines are usually the worst. Malt liquors are terrible. I call them fake alcohols, but a lot of your wine coolers and a
Yeah.
lot of people are drinking these new ones where it's a vodka with a sweetener in it. Those will cause headaches. Uh, I'm trying to think what else we could talk about. Some people, stinky cheeses, things I love, like blue cheese or brie, can provoke migraines in some patients. Some people report fava beans or some of the weird legumes will do it as well. But I would say caffeine, artificial sweeteners, alcohol, and skipping meals are probably your biggest lifestyle changes.
How
Uh,
about water? I've heard it's important to
that's
drink
very, very good.
significant
Yes.
amounts
You
of
got to
water.
stay hydrated. So your brains are 95% to 98% water. And
Did you say 95% water?
oh, yes,
I didn't know that. 95% of your brain is water.
pretty much. And fat, water and fat.
So drinking, obviously, I've heard this over and over and again, and I'm terrible at it. But I've heard that 8 glasses or whatever it is, but keeping yourself hydrated is a key to helping avoid headaches and or migraines.
Yes, yes, absolutely. Because you got to keep the hydration up, and then and remember, the brain at any given time uses 90% of our body's oxygen, nutrients, and water. So, I think as Americans, I always love to ask the question, how much water do you take in a day? And then everybody laughs and says, I don't. Or we use caffeinated beverages. So caffeine is just like alcohol, it's a diuretic. So if you drank enough coffee all day, at the end of the day, if you drank 120 ounces of coffee, you're going to urinate out more water than you actually took in the coffee, so you're going to stay dehydrated. So most Americans are dehydrated, and that's what they'll get in the ER if they go with a headache. The first thing the ER doctor will do is hang a bag of normal saline, a liter, and at least get a liter in them to rehydrate them.
Yet we all walk around with water bottles and we're all not hydrated
And
enough.
not drinking it, yes. The
Not
other thing too
drinking
is with oxygen, I have a lot of sleep apnea patients in my office. So patients with sleep apnea that don't treat it with CPAP definitely will have bad headaches, often intractable headaches and migraines. So again, that comes with oxygen. Is your oxygen sufficient in your brain and in your body? So I always encourage those patients to see a sleep specialist or their family doctors to get put on CPAP. And that's when with patients, migraine sufferers who wake up with a migraine or wake up with headaches every day, we're taught that that's sleep apnea until proven otherwise. So that usually involves getting a sleep study on those patients.
Well, our time is up, and I want to thank you, Dr. Lynch, for your patience. For our audience sake, we've tried this 2 or 3 times and have had technical problems and heating and air conditioning, not air conditioning, heating blowers going on right in the middle of it. But I want to thank you first for what you do. Headaches are common. People struggle from them, and they should not be afraid to see their primary care doc, as we mentioned early on, and get a referral to come and see you, because you can clearly, in working with them, make their life a lot easier and a lot
Absolutely.
less painless. So
Yes.
thank you for what you do. We appreciate your time, and our guest today has been Dr. Lynch, and our program is LECOM Health Matters. Thank you for being with us.
Thank you so much.
Thank you, Ryan.